All right. So we are back with Miss April, who again, I'm so grateful that she allowed us to video and to share the process of her getting her pellets. And so what I want to discuss for just a moment is how do we know what dose to give to patients? Does everyone get the same dose? And the answer to that is no. So there are different factors that go into computing what dose each patient needs. So we truly do individualize the treatment. And so factors such as a patient's weight, a patient's level of activity, and also her lab work. So we do have to check the hormonal labs prior to doing pellets, and all of that goes into a formula. In addition, what symptoms are the patients having, and other factors too that may affect some of the side effects or the patient's experience. So all of that is computed and then we get a dose. And so we've already calculated that dose. We know what dose works for Miss April. And so the pellets come in little packets. In just a moment, we're gonna open these packets and you'll be able to see what the pellets look like. But I typically will describe them as looking like little grains of rice because they truly are that small. So for the pellet, what I typically like to do is I like to mark where I want her pellets to go. And so you're gonna see me just making a little mark here. So one question that I will often have from patients is, do I get an incision every time I get pellets? Am I gonna have marks just everywhere on my bottom? We choose to insert them on the bottom in females, by the way, because hormones get absorbed better in fatty tissue. And so we like to go in an area where there's going to be good absorption, but also where you can still wear that bikini if you want to, right? And so we don't make an incision, a new incision. This is already an existing incision. And so every time we do a pellet on this side, I use the same insertion, or the same incision, excuse me, for 3 different pellet insertions. So you won't have a lot of incisions with my method. Okay, so we've done that, and now we're just going to prepare the skin here. And we're going to first just use a topical numbing spray. And what that numbing spray does is that it allows the patient to not feel that needle stick as much and also not feel the lidocaine. So I'm just going to ask my assistant, I may need another bottle. If you'll just grab me another bottle of this. All right. So cold spray coming April. Mm-hmm. Perfect. Could you take that towel for me, please? Thank you. I'm gonna need another bottle. I'm gonna need another spray bottle. All right, Ashley gets me another one here. We'll see if we can get any more out of this bottle. You feel it getting cold in April? A little bit? Just a little bit, yeah. We have got all we're gonna get out of these 2. There we go. Out of these 2 bottles here. Okay. So the lidocaine is what truly numbs the skin. Okay. And just to make sure that skin is numb prior to using this, we'll use a little bit more spray here. And what it does, it causes the skin to feel really, really cold. But it usually does do a pretty good job of numbing the skin here. But we do want a little bit more of an anesthetic effect than what the spray gives us. So we're just going to inject this lidocaine along the area where we're going to make the incision. also going to inject the area where that pellet is going to go. Get her nice and numb here. Now, I am a pellet patient myself, so I have taken the time to try to perfect this technique to decrease the discomfort, because it's one thing to look forward to going in and getting your pellets so that you feel better, but it's another thing to also at the same time dread going because it's painful or uncomfortable. So I think we've done a pretty good job here of trying to make this procedure as comfortable as possible. Okay, and I'll take that betadine. Actually, have it right here. Just another layer of protection against infection. We use antiseptic over the skin here. So you're gonna see me prepping this area where we're gonna make the incision. I'm gonna give that to my assistant. And now I'm gonna switch over to sterile gloves because everything following numbing up the skin, I do under sterile conditions. I will grab that from you in just a moment here. Okay. All right, so we have the scalpel for our skin incision. Other instruments here, and everything is sterile. All right, I like to just kind of confirm the doses, but I have had a chance to look, so I know we have the doses that I want for this particular patient, so we won't call out those doses. But typically that is just another level of another checkpoint. Okay, and I want to show you what these pellets look like here. All right, so this is our estrogen pellet, and you see how small that is? Okay, so this is going to go in my sterile cup until I'm ready to insert it. And now we're going to get the testosterone pellets. Our testosterone pellets are a little larger, but relatively they're still small. So hold on just a minute, let me get that other still a little segment there of that. Okay, and then our second testosterone pellet here. And I truly customize them. So not only do I customize the dose, but April and I had a discussion, and I decided to, after discussing what her current symptoms are, we made an adjustment with the formulation. And so we will then follow up with her and see how that works for her as well. So I'm going to make this incision here. Again, we've already numbed up the skin. I'm using an incision that I made before for one of her former pellets here. You don't see her flinching, and trust me, she's not that good of an actress. So if it was painful, I'm sure she would have reacted. So this is what we call an introducer. So I'm going to just insert this. This is how we introduce the pellets beneath the skin. We kind of created a tunnel here. As you can see, it's not gory. There's not a lot of blood. Again, the key is to keep everything sterile. And that way you significantly reduce any complications of infection. I'm going to use this. And again, the pellets go right beneath the skin. Her pellets are in. That simple, that painless. And now it's just a matter of us just applying the bandage, and she's all done for today. a little off.